The drug users movement is a global movement of people who are working to create a world that is accepting and inclusive. We have been in existence for more than 30 years, and in 2014 we continue to grow stronger in the face of urgent health, legal and human rights issues threatening the communities in which we all live. This film shows only a small part of the scale, diversity and achievements of the global drug user movement, working for progress towards a more humane world for us all. Drug user organizations have developed in response to a war against our communities. We have been hit hard by the consequences of the war: overdose, hepatitis B, hepatitis C, HIV, TB, imprisonment, violence, torture, sexual assault and rape, and the death penalty. These are just some of the individual costs of the war, while the economic costs of this expensive and ineffective war affect us all. You are about to meet people in our truly international community who are dealing with the consequences of the war on drugs. Some of it may be familiar to you, the difficulties, prejudices and the violence that has come with these failed drug policies. No matter how familiar the issues may be, it is the people in this film who will move you. They will impress you with their courage, and they will inspire you to stand with them for justice, compassion and humanity.
We are here today ready to negotiate the peace.
Input aims to ensure that the views of the drug-using community are heard in all global advocacy spaces, to ensure an end to the war on drugs, to guarantee our human rights, and to put an end to stigma, discrimination and criminalisation.
My name is Umesh. I'm from Manipur. I'm people who use drugs.
I'm a drug user from Nepal.
I'm a drug user.
We are drug users and we want to be treated with dignity, respect and basic human rights.
We have one drug user org in our state, and for 7 months now we've been training users with naloxone. That's equated to 171 peers trained and given naloxone, and that has resulted in 14 reversals. And you know how much public healthcare funding we got to do that? Zero.
Funding for HIV prevention hasn't been targeted at the right groups. We know that if we were putting funding into drug user networks and harm reduction services, that it would be far more effective than the generalised community funding that's been so popular.
საქართველოში არსებული ტრადიციების გამო ნარკოტიკების მომხმარებელი ქალები ორმაგად უფრო სტიგმატიზირებულები არიან როგორც საზოგადოების, ასევე თვითონ ნარკოტიკების მომხმარებლების მხრიდან.
I feel that we don't have any kind of services for youth, especially on women. We can't provide them proper services, you know.
Người sử dụng ma túy tại Việt Nam, điều thứ nhất là chúng tôi cần có những các cái chương trình điều trị nghiện ở tại cộng đồng, đặc biệt là đối với chương trình những người sử dụng các cái loại ma túy tổng hợp như là đá thì hiện nay chưa có các cái phương pháp điều trị gì cho chúng tôi.
We drug users and people living with HIV and AIDS, we need empowerment.
We have a lot of issues like regarding the drug overdose. A lot of the PUD was died for the overdose. Because of that, we have organized rally on access to naloxone. The slogan is stop dying of overdose.
2013 წელს შეიქმნა ნარკოტიკების მომხმარებელთა ქსელი. ამ ქსელმა შინაგან საქმეთა სამინისტროსთან გამართა ქუჩის ნარკოტესტირების წინააღმდეგ აქცია. ჩვენ მიღწევად მიგვაჩნია, რომ მოპყრობილი იქნა მასმედიის ყურადღება. თითქმის ყველა სატელევიზიო არხით გაშუქებული იქნა ეს აქცია. ასევე ჩვენს მიერ შექმნილ პეტიციას მოყვა რეაგირება საქართველოს პარლამენტიდან და პეტიცია ჩვენს მიერ წარდგენილი იქნა პარლამენტის ჯანდაცვის კომიტეტის სხდომაზე. შემდგომი რეაგირებისთვის პეტიცია გადაეცა ჯანდაცვის სამინისტროს.
Take off the mask and let it be known that it is not a war on drugs but a war on people.
Passionate,
Empowerment,
incredible, dedicated,
mobilization,
Integrity,
inclusive,
community,
comradeship, passion,
взаимодействие,
dignity, care-focused and awesome.
A fundamental belief behind the work of drug user organizations is that all people deserve to be treated with dignity and respect. Our community organisations are working often with no or limited resources and very little support. Many of us face discrimination and the risk of imprisonment and violence every day, but it doesn't stop us. We continue to provide life-saving services and programs to care for our friends, our brothers, our sisters, and our communities.
When the drug using scenario was really pretty bad in our prison, and 7 of us actually started this organization who belong to the drug using community. I'm really hopeful that we are going to be able to address the needs. With a unified voice, the voice is going to be very, very loud. It's going to be heard at national level and international level.
At the moment, 150 drug users will get employed and they can have happy life, stable life, and them children can go to school, them wife or husband, them family can be very happy.
Drug users unions forming all over the country when it comes to drug users, fighting for their rights as users when it comes to, once again, there can be nothing about us without us.
Peer education, respectful,
support,
community, outreach,
love,
Результат.
We care,
empowerment,
trust, peer-driven.
Harm Reduction Victoria's Peer Networker project is the very first time that a peer distribution project has been run in Australia. We know that they've been really successful in other countries, and from what we're seeing already with the first of 4 sites that we're rolling out in 2014, is that it really complements Needle & Syringe program, and it is increasing access for hard to reach high-risk groups.
ჩვენ დიდ მიღწევად მიგვაჩნია ის, რომ ჩვენთან ორგანიზაციაში დღესდღეობით მუშაობს ბევრი ქალბატონი, შეიქმნა საინიციატივო ჯგუფი, ისინი მზად არიან ხმამაღლა ილაპარაკონ და ასევე იბრძოლონ თავიანთი პრობლემების გადასაჭრელად. ისინი ასევე ჩართულები არიან ხელსაქმეში, ისინი ამზადებენ სხვადასხვა ნამუშევრებს, რომლებსაც შემდეგ ფენენ სხვადასხვა გამოფენაზე.
We have fought to make the drug users' situation safer and better.
The Connection is a service run by and for Aboriginal and Torres Strait Islander drug users. Our aim is to reduce the harms associated with illicit and injecting drug use. We achieve this through peer support, advocacy, referral and education.
I would say our Hepatitis C project, Live or Die, is one of Swedish Drug Users Union's greatest achievements, because I think it's a big recognition for a drug users organization to get the request by an authority like Public Health Agency of Sweden to start this big, informative, not to mention important project.
Our greatest achievements, I think, was without doubt the Healthy Liver Clinic. It clearly enhanced the number of people who access the clinic. It enhanced their engagement with the clinical staff and their access to testing and also to treatment for hepatitis C.
Right now we are providing marathon services in Butthol, it's Rupundehi district in Nepal.
Working in collaboration with our government, we have been able to provide free methadone to around 150 drug users in Lalitpur district, and we have been providing needle syringes freely, free needle syringes to male and female drug users back in Kathmandu.
We run an naloxone and opioid overdose training program. It's had a number of firsts to its name. It's the first naloxone program in Australia, it's the first peer-run naloxone training program in Australia, and it's the first in the world to be run in a prison.
I think our greatest achievement in the New Zealand Needle Exchange program has been that we set up a very early national program, which meant we got a good reach.
We do overdose management, and we practice a syringe exchange program very well. We provide free condoms.
And then just the stigma.
Evidence-based. Colourful, committed.
Barba.
Indomitable.
Confident.
Human rights.
Steadfast.
Creative. We refuse to lie down and die.
End the war on people who use drugs.
The negative impact of criminalising some drugs has led to a culture that supports extreme levels of stigma, discrimination, and human rights violations against people who use drugs by the general community, by police, in prisons, in compulsory and coercive treatment services, and in healthcare settings generally. People who use drugs themselves have led the way by organizing, raising awareness, and responding to issues impacting our community. A key aspect of the work of international, regional, and national drug user organizations is involvement in high-level advocacy and policy development work that is central to ending prohibition and its impact on our lives.
Sanput has achieved many things. We've been able to do human rights, drug law reform, advocacy, and national and international level peer education, and also harm reduction. And we've been able to participate in the World AIDS Day and Hepatitis Day.
ABLE is the national organisation representing people who inject drugs in Australia. We are run by and for people who inject drugs. One of the biggest achievements for ABLE and the drug using community has been our role in maintaining extremely low levels of HIV among people who inject drugs in Australia for over 2 decades and counting.
We have been able to collaborate with the local organizations and the programs and also internationally and regionally.
We are working for treatment, care and support, as well as advocacy for drug users, as well as people living with HIV and AIDS in my country.
Underneath all of the policy work, the peer education, the advocacy and the community development, our work is about empowering users and saving lives.
Passion for our cause, energy to drive change, commitment to our communities. We are drug users. The war on drugs is a war on us. A war that has affected everyone on some level, personally within their family, their community, their country or region. And the collateral damage is profound on a global scale. It is a war that has eroded people's basic rights to health and humanity. As we speak, it is resulting in untold levels of human suffering, discrimination, disease, and death. But we are drug users, and we are fighting back. By joining the global drug user movement, by protesting for our rights, by advocating for needle and syringe programs and opioid substitution treatment, by fighting for universal access to the best treatments for HIV and hepatitis C, and by speaking out at conferences and meetings about the impact of criminalization on our lives. We are drug users, and we are demanding our basic rights, but we cannot achieve this alone. We are inviting the global community to join with us and be united in our call to stop the stigma and discrimination, the human rights violations, the violence and abuse, the arbitrary detention and imprisonment, the institutionalized corruption, particularly within law enforcement, the levels of preventable disease and death, and the misuse of government resources to fund and continue the war on drugs. We are drug users, and the war being waged against us must end. Surely we all want it to end, but the fight to end this war will not be easy. It will be hard, and there will be costs. We need you to stand and fight the hard fight with us to end prohibition, to end the war on drugs, because the next casualty on the war on drug users may be someone you care about.